symptoms of Lyme disease, which, at least to me, was an entirely new idea. So why is it that we are now hearing more about this, Angela?
Well, I don't know if you're hearing more about this, but I think Lyme disease itself is pandemic, and what we really want to get out to the public is the fact that there is a psychiatric component to Lyme disease.
Mm-hmm. Well, what are the symptoms?
Well, can I just say one other thing about
You
what
sure
you're
may.
saying? Also, this is not a new topic in that since 1896, people have always asked, is microbes the cause of insanity? There was an article that had come out I think it was a scientific journal at the time, and it had asked, is insanity caused by a microbe? So this isn't really a new topic. It's just that Lyme disease, as it is now, is being more and more diagnosed, so we're seeing the effects of it.
Yeah, and I think it's more and more common as well as more and more diagnosed.
It's important to keep in mind, as you said, that mental illness, such as schizophrenia or major depression or bipolar disorder, mental illness is a biologically based disease of the brain, so that any other biologically based disease of the brain may have accompanied symptoms that would be characterized under mental illness.
Mm-hmm. Which I guess makes it hard to diagnose the Lyme disease component, if that's the case.
Right, definitely. But it's important to keep in mind that because mental illness is a disease of the brain, that that it can be caused by an infectious process.
Mm-hmm. Mm-hmm.
That very often what we call a disease of the brain is simply a symptom of a physical illness.
Mm-hmm. Yes. Well, what are some of these symptoms?
Well, one of the things about Lyme disease is that it can mimic just about any psychological or psychiatric disorder that's out there. So many times people will be given diagnoses when they come into a doctor's office. The doctor may say, you're having this symptom, and the patient may say, I'm just, very tired, and they may say, oh, well, maybe you're depressed, you should go see a psychologist or a social worker, when indeed they're not asking other questions about other symptoms that the person may be having, because maybe the way that our system is set up, where people are sort of separated into, you go to a doctor for this, if you have this symptom, another doctor for this. So that's part of the problem.
Mm-hmm.
So
the age of specialization.
Yeah,
Exactly.
Right.
Yeah, absolutely.
Lyme disease is caused by, generally caused by a tick bite, and it's the tick that introduces into the body, into the human body, the spirochete that causes Lyme disease. And the symptoms really can appear anywhere in the body. Typically, you have flu-like symptoms. You may have aching joints. Once it gets into the brain, you may have trouble thinking, trouble concentrating. You may have depression. You may have anxiety, severe anxiety, rage behavior, panic disorder. That once it gets inside the brain, it can cause a whole host of symptoms that would be typically seen as a psychiatric problem or a mental illness.
Mm-hmm.
Right, but not necessarily a toxic process or an infectious process. Years ago, neurosyphilis was known throughout the world as causing mental problems. People went mad from syphilis. But somehow, with the advent of antibiotics and modern medicine, all of that thinking about the connection between infectious disease and mental health got lost. And what we're saying is it's time to start thinking about that again. It's time to shift that paradigm back, especially when it comes to Lyme disease, because really, basically, it's a Lyme encephalitis. When those spirochetes cross the blood-brain barrier, get into the brain, that's when it wreaks the havoc, and that's when you get the cognitive impairments and you get the emotional difficulties.
Well, isn't Lyme disease also treated with an antibiotic generally?
the treatment is antibiotic treatment. It's not clear how long that treatment should be. There's a lot of controversy right now about how long the treatment should be and what it takes to eradicate the illness. And for many people who are bitten, who know right away they're bitten because they have what's called a bullseye rash, and they go to their doctor and they get a course of antibiotics, and that's the end of it. For someone who does not get the bullseye rash, the disease may go unnoticed for a while, and the person may start to have a whole multiple of symptoms. It could start to feel terribly tired, trouble concentrating, may have stomach problems, may have some joint problems, may have some cardiac difficulties. The spirochete can travel and be anywhere in the body.
Well, it's no wonder it gets confounded with a lot of other illnesses, because I mean, if you read the symptoms of, I mean, I always read these little inserts in medications, you know, and it always can cause dizziness, headache, nausea, you know, and it almost sounds as though these are universal
definitely
things to any kind of antibiotic, as well as you know, just sort of general symptoms.
Definitely.
So it is hard to diagnose.
It's very difficult to diagnose. And also what Judith was saying about how it's, you know, some people that come into the office when it's early on, you know, they have the bullseye rash. It's a very small percentage of patients that actually have that. And so that's a lot of the problem with the diagnosis is, and then also that the testing is very inaccurate and inadequate. We need to develop better testing. Spirochetes are very evolved organisms, and they're very difficult to culture and to find in the body. So they can evade your immune system very easily.
Yeah. Well, the traditional test, I had Lyme disease once, and I did have the bullseye rash, but the doctor who was a doctor who should have known that, because he was in Westchester, where Lyme disease is very prevalent, particularly in the spring and the summer, and when there are a lot of ticks around and people go out gardening and they don't follow the prescriptions because it's a pain in the neck to put on gloves and tuck your, you know, so a lot of people now are being exposed to that, and the doctor simply didn't recognize it, and he didn't want to send me for a test. But eventually I insisted, and it was Lyme disease, and much to the doctor's surprise. Well,
there's a difference too between acute Lyme disease, you got it early, and the people that chronic Lyme disease, where it's not detected, and it cannot show up for weeks, months, years, and then at a time of stress it can come out, and then it seems to be coming from nowhere, especially when it comes as a mental health problem. Then you've got a real difficulty, and it's not unusual for people to go from psychiatrist to psychiatrist, from doctor to doctor, you know, before they actually get a diagnosis, and some people never do.
Yeah, and they don't know what it is that's bothering them. They just know they don't feel as though they're in good health or anything like that.
The one thing that you did, though, you said that you asked your doctor for the test.
Yes.
So you advocated for yourself, and so I think one thing that's very important is to educate the public about the reality of what's happening with Lyme disease presently, so that people can ask their doctor and say, hey, listen, you know, all of a sudden I feel like this and I don't know why, and you're telling me I'm depressed, but I'd like to know, you know, if there are other options for me out there.
Well, that fits in something which is very important generally now medically, of people becoming more aware of their body and learning more. And I guess to some extent the internet helps. It can be very confusing because you get a lot of conflicting information, a lot of inadequate information, but I think anything you learn can be helpful.
Definitely.
You know.
If anyone goes on to the internet now to research Lyme disease, they will see that there is a controversy about it in terms of diagnosis, in terms of treatment, in terms of even what is Lyme disease. There are some people who believe that once the infection gets in the body, if it's not treated, that it stays in the body for a long, long time. There are some researchers and individuals who believe that you can get the infection out of the body, but then there are secondary problems that can arise, changes in the immune system, metabolic changes, biochemical changes, inflammatory responses, so that it's a very complex picture.
Now tell me, you work a lot with kids with Lyme disease, am I correct?
Right. In my practice, I see children very frequently. Typically, the children who come to me have already been diagnosed with Lyme disease, and are having school problems, and I'm asked to do neuropsychological testing to try to delineate what their difficulties are and what their strengths are, and then make recommendations for accommodations and for school. Typically, the children who come to me, and they can be, I see preschoolers all the way up to through adolescence. They often come with a history of frequent infections from infancy, if they've had it for a long time.
If the immune system is down.
Right. And they have a lot of subtle developmental problems, some minor motor problems. They may have difficulty processing auditory information, so that their language development is a little off. They may have some hearing problems. All of these things will interfere with their performance in school. There are children I see who were doing well and then got a tick bite and then became ill.
Fell back.
And then developed school problems. So these are children who were good students, and all of a sudden their grades start to drop because they're having trouble thinking, they're having trouble concentrating, they're ill a lot, so they miss a lot of school. It becomes a very large problem. It's also typical to see, when we see children in our practice, it is typical that other children in the family have Lyme disease, or that the parents have it, so that it's a real family problem. It's not just...
Well, it's not through hereditary. It's because they're exposed probably in the same area to a fair amount of tick bites.
Right, exactly.
Potential tick bites.
And a child can contract it in utero. If the mom is bitten while she's pregnant, the child actually can become infected with Lyme.
The child could be born with Lyme disease?
It crosses the placenta. Yeah.
There's evidence. There's a lot of evidence. Again, it's as if you go on to just Google Lyme disease, and you'll open up a whole whole Pandora's box of
garden of ticks or whatever
of controversy and different thought. And there's really just there's a tremendous effort now in the Lyme community and the infectious disease community to really try to understand what it's all about. There's a lot.
I think you were also asking, what are the symptoms for children?
Yes, are they the same as in adults, pretty much, other than the school evidenced symptoms?
That for sure, but I think one of the big ones is headaches, isn't it? I mean, children with Lyme often develop these horrible, horrible headaches, which just never go away. That's one of the symptoms. And when they can be changing friends, they could have that sudden drop in their grades. They're tired. They can't sleep enough. They have to take naps. They have no energy. They can't play sports any longer. When you see that dramatic shift in their functioning, then you have to think about Lyme disease.
I feel so badly for the parents, because they're faced with this, like not knowing where to turn. I mean, there are so many possibilities, so many symptoms.
Right. That's why we're doing this program.
Yes. Well, I hope that parents are listening. Now, in the schools, who would be likely to run into this? Would it be the classroom teacher might detect a little fallback in grades and things.
The classroom teacher would detect a drop in grades, or might detect that the child is erratic in school performance, because one of the characteristics of Lyme is that it is a so-called undulating, the symptoms are undulating, they come and go, they wax and wane, so that a child may be fine one day and be able to focus and concentrate, and the next day can't. And the teacher doesn't understand that. The teacher very often will say, you know, you just didn't try, you know, you clearly didn't study.
Well, because the symptoms are similar to a lot of childhood psychiatric illnesses.
Right. The other thing we see in children, this can be very frightening for parents, is terrible rage reactions in children. We see panic disorders, we see obsessive compulsive disorders.
Tourette's.
Tourette's. Sometimes you get seizures as well. And children have terrible, terrible rage reactions. And the children themselves are very frightened by it. They don't know why it's happening, and they always are upset afterwards.
From what you're saying, I gather one of the keys to this is to seek treatment early.
Well, it's to seek treatment early. The problem is because it's such an unclear picture, because it's just a host of a lot of symptoms, it's often hard to seek treatment early because you're not sure what's going on. So
and by now you've run around to 10 different doctors.
Right. Probably more, like 300 doctors.
And you're ready to throw up your hands and say, you know, he'll grow out of it.
Exactly. And also parents come with a lot of different diagnoses. They come with, the children have been diagnosed with attention deficit disorder. They've been diagnosed with sensory, sensory motor integration difficulties, auditory processing difficulties. A lot of the children also are diagnosed with autism or autistic-like behavior. And one of the, in terms of symptoms for children, one of the major symptoms that we see in our practice is children with terrible sensory sensitivities. They're very sensitive to light, to sounds, to touch, so that they often withdraw when they're overstimulated, and that can look like autistic-like behavior. Their skin is very sensitive.
Pervasive developmental disorder. I have a child right now that I'm working with that I suspect actually has Lyme, and I'm trying to get the parents to have him evaluated.
In this particularly?
Sometimes,
Yes.
The school nurse is involved if the school nurse allows the child to come to her when there's a problem. The key to it is how the school handles it, and the leeway that the school gives to the child and
That's
to
once
the parents.
they're diagnosed, though.
Yeah.
But if they're not diagnosed, the nurses,
Then it's a problem.
if they know about Lyme, might be able to refer or talk to the parents. But often they don't. I know there are different people trying to do education in that area too.
There are some newer things going on with some organizations that are dedicated to Lyme disease that are going out to educate the Department of Health and the school districts around how do you educate families and kids about Lyme disease.
What are some of those organizations?
Time for Lyme, it's in Greenwich, Connecticut, and they've developed a protocol to work with the school districts, and it's through the Department of Health. They have it in several different school districts. Greenwich, I think Rye, in Westchester, it's going to be doing that soon, and then hopefully in Suffolk County. So we're trying to educate people about this so that, you know, if a teacher will hear this or a parent will hear it, they'll learn more about it, and same with the kids. So there is a real effort to educate.
There's a whole new organization too, Lyme-induced autism or something.
The other thing is it's very, when it comes to children and trying to get accommodations in school, it's important for parents to know that they are entitled to accommodations if the child carries a medical diagnosis, that they are required, the schools are required by law to provide accommodations. And
Yes, that's newly being tried in various
Right.
court cases,
Yes.
and I
Yeah.
guess
Yes.
that's
yeah.
it hasn't yet come up in terms of Lyme disease. I don't believe in a court
Yeah,
case.
in the court. No, but we do a lot of work in that area, and actually going to schools and working with the schools to put accommodations in place for children. And many of the schools are wonderful about trying to make those accommodations once they understand
Right.
what the problem is.
Yeah.
Now, Mindy Beth, you work more with adults.
Yeah, I work mostly with adults.
What can you do as a psychotherapist working with adults?
Well, I think one of the most important things that you can do when you're working with a patient is when they come to your office, they've probably been to so many doctors, and when they finally, if they do have a diagnosis of Lyme when they come to your office, it can feel like so difficult because to talk about what's happened, and mainly to just give them a sense that you believe in everything that's happening, because oftentimes they go to doctors and doctors just say, oh, well, I don't know what that is, or to just make them feel a little bit more comfortable about what's happened, because a lot of times they're very traumatized
Yes.
by what their experience has been.
They have to reassure them that they're not being hypochondriacal
Yes.
about it, that,
Right.
that there actually is something
Wrong.
the
Right.
matter.
It's a
to start to
relief.
trust themselves again, because I think often they don't trust themselves anymore. You know, because they've been told so many times, you know, maybe it's this or that, or they get confused. So just start to trust in their own intuition.
It's
Can
it's
you
a
give them hope that that this will get better? I mean, do you recover?
Well, that's a little bit around what Judith and Angela was mentioning earlier about the controversy of Lyme disease and what the treatment options are. And so, you know, it's really a hard question to answer. I do know people who've had chronic Lyme disease who have recovered and are in remission and are doing well. But again, there are people that may not do well. It just depends. It's kind of a hard question to answer. And also, one of the other things I just wanted to mention was you talked about it as Lyme disease, and one of the things that we're realizing, and there's a great research center that was just started at Columbia, and they're doing a lot of research into what is inside of ticks. And they're not just spirochetes inside of ticks. There are many other co-infections that can cause other kinds of problems, some of them psychiatric in nature. So that needs to be also understood, and so we need better research.
So all of this infection-borne illnesses are now being investigated from several different
Right.
angles.
There's
both
bacteria,
from the-
there's viruses, there's protozoa, there's,
Yeah.
It's the thing to keep in mind is once these organisms get inside the brain, that they can wreak havoc. And since our bodies are controlled by our brains, and everything we think and feel originates in the brain, it can just have profound implications.
profoundly disabling.
Yes.
What can families do? You say you're on a mission. What is your mission?
The mission is to get the word out. The mission really is to help the psychiatric community in particular to understand the sequela, the mental health issues, the sequela of Lyme disease and other tick-borne diseases, because there's such vast ignorance about it, especially in the psychiatric community. I mean, we're psychologically minded, you know, and there's something else. There's Munchausen's by proxy.
Yes,
that parents have had to deal with, where children have actually been taken out of people's homes.
Yes.
Because they're searching for a diagnosis for their kids. They're
And
searching for a
the
cure.
parents get blamed sometimes
And
too.
the parents get blamed, and the kids are taken away, and some of them with disastrous results.
Well, the good news that there is hope, that we're investigating this on many counts, and both from the standpoint of biology and psychiatrically and neuropsychiatrically. I wish all these words weren't so long. So I want to thank the three of you for coming today.
Well,
and I
thank you.
want to thank my crew for putting together the show.